Welcome to Just Therapy, the podcast where we dive into mental health, family, faith, and living with traditional and conservative values. Whether you're looking for practical advice, seeking clarity, or simply want to strengthen the foundation of your life, you're in the right place. Together with fellow counselors, we'll tackle tough topics, answer your most pressing questions, and explore how traditional values and modern care can work hand in hand to build stronger, healthier lives. Today, I have the privilege of welcoming my very first podcast guest, Pamela Garfield Yeager, also known as the Truthful Therapist. Pam is a licensed clinical social worker with years of experience in mental health, a powerful story of resilience, and an unapologetic commitment to truth and therapy. And in this episode, we're diving into some big topics: how therapy has evolved and not always for the better, empowering parents to stay involved in their children's mental health, and how traditional values and objective truth can guide us to live healthier, more connected lives. Pam also shares insights from her book, A Practical Response to Gender Distress: Tips and Tools for Families, offering practical advice for navigating challenging topics with clarity and compassion. Our conversation is for anyone who wants to feel empowered in their role as a parent, a therapist, or simply as a person navigating today's complex world. So grab a cup of coffee or tea, settle in, and let's get started. Hey, Pam, you are my first guest for the Just Therapy
Yay!
podcast. I'm so excited to have you. Welcome to Just Therapy.
This is so exciting. I feel really honored.
Do you? Oh, well, I'm honored to have
Yeah.
you. I know you and I have been friendly for some time. I call you a friend now, and I'm just grateful that you're here. And when I had this idea for this podcast, you were one of my first people that was go for it, don't stop, just do it. So thank you. So share with our audience a little bit about who you are, what you do, and how you help people.
Yeah, I have this whole journey of, I don't know, life and mental health experience combined. In terms of my mental health experience, I'm a licensed clinical social worker. We'll get into a little more about what I think about that now, but at the time that was good.
Yeah.
And did a lot of work within mental health. I started off in New York City, working in the inner city, working in schools, and working with families, a lot of family work. And then I moved from New York to California, and then I got involved with foster kids and like more trouble kids, residential programs. Also worked in adult treatment programs, so they're called IOP and PHP. Um, Partial hospitalization program or individual outpatient programs. So those are programs for people with mental health issues to help them get more stable. And so I did all of that. I also had a private practice, and then I became a clinical supervisor. And then I worked at UCSF for a time. And what happened at UCSF is I actually got a repetitive stress injury from a bad desk they gave me,
Mm.
and I had to drop out of work. It got really, really bad, and that disability went on for like 4 years. So that started in 2017. I didn't think I'd ever get back to work. And then I did finally get back to work in 2021, through the lockdowns in California. Things were still fairly locked down. We're still wearing masks. It was a healthcare setting, and then it was a PHP program for adults and teens. When I came back to that program, everything was so radically different.
Hmm.
I was like Rip Van Winkle, somebody who was like asleep and came back to just like a completely different world. And they had forced the COVID vaccine on me after all the health issues went through. I chose not to take it because I had already recovered from COVID and I was pretty healthy. So
Hmm.
I said no, and I was still getting partial disability. I had nothing to lose after being displaced all of that time. So I decided to become public about all the crazy things I was seeing in our profession, all the madness. And my eyes were really open to things that were even from the past that weren't quite as radical as they are now, but were brewing back then. And so I became publicly known as the truthful therapist. My husband came up with that tagline because I was one of the few that was just telling the truth. I was like a little kid naming that the emperor had no clothes, that our profession was just ridiculous. And I got involved in some documentaries. I started writing. I started providing consultations for families just to help them find counseling that's not, crazy, not woke, not radical, not telling them that their kid could have a million genders, and not telling them that they're naturally oppressed or an oppressor because of the color of their skin,
Yeah.
things like that.
Yeah. So you've had quite the
So,
journey to where you are
yeah.
today. And you've written a book and you're
And
working
I've
on
written
another
a
one.
book since
Hmm.
then. Yes, that's been my biggest accomplishment, I think, thus far, especially as someone who's still kind of dealing with some nerve issues. So I've written a book and I'm working on some CEU courses, which you have actually helped me get started on,
Awesome. That's
working
great.
with people with like legislators and things like that, which is just lots of cool things to make a difference that I think other people that it's like this weird blessing, right? I had this disability that enabled me to just be so public and so bold and then meet some people that can really move the needle. And things have shifted already, which is exciting.
Yeah. Yeah, it is exciting. And you've come kind of, you've had your own evolution as a, I would say, traditional conservative thinker now, right? You didn't, that's not how you were raised, right?
No, not at
Yeah.
all.
Yeah.
That's been a big shift. Honestly, so 2020 was my big like red pill year, we'll say.
Yeah.
I was a classical liberal. I was a lifelong Democrat, kind of a default liberal, I'd say. Not someone that was really passionate about politics or passionate about these topics, but just kind of went along with them and thought they were okay.
Mhm.
Honestly, when I was a lot younger, when I went to college in the 90s taking sociology classes and these social work classes, I definitely was more left-leaning than the general population. I was the one that knew about these woke ideas, I think, before they became mainstream.
Yeah.
I learned about my white privilege, and I actually believe that I had that just,
Mm.
inherently. But I didn't take it as literally as it's used nowadays. And then, of course, I started to see it more in a radical way, and I realized that the whole thing was a lie.
Yeah. Yeah. And I honestly, being the first episode, I don't know who will be listening to this. I'm hoping that we'll have people with different beliefs and values when it comes to therapy and mental health. But I think it's really interesting that it's important that you somewhere along the line started to question what your beliefs and your values were. And I went through a similar shift as well in my probably in my early 30s. And you and I are the same age, 51. Woo, Gen X.
Woohoo!
All right. And I know I don't want to make this podcast is not political, but I do think it's kind of important because to talk just a little bit about it before we dive into it, because how do you come to like the conservative values? How do you come to the place of where traditional and moral compass and objective truths, when does that become important? And I think as counselors in this field, it was kind of a given up until maybe 10, 15, 10, 12 years ago when all of a sudden it started to become the new way of counseling was this whole subjective truth. What is your
Hmm.
truth is your reality, where it's like, yeah, maybe so, but that could also get in the way of leading a very healthy, functioning, normal life. Is that something that you want to maybe you could explore that, but I don't know if you want to make that the norm for people as a counselor. That's kind of the way that I evolved into where I am today, was seeing how so much mental health support out there is, oh, it's your subjective truth. Whatever you believe is your reality, is the reality. And people should respect that and should be open to it. And you tell them what you want them to know about you. And if they don't believe you or if they don't agree with you, then they're in the wrong or they're the ones that are not right or not well. And so I just couldn't get on
Hmm.
board with that. Like I just like that's I feel for people. I want to understand where they're coming from, but I don't believe that that helps them become a healthy person at the end of the day. If it's getting in the way of their daily functioning and working and getting through the day, it's like let's take a look at that and really dissect what's going on.
I
Yeah.
agree. And I know it's like what is political and what is just
Hmm.
reality or what is
Yeah.
functional or what is what will help us lead fulfilling functional
Yeah.
lives. That's really what this is about. It's not really about like what camp do you belong
Right.
in. It's just about figuring out what's going to make you live the best life
Right.
that you
Right.
can. I was trained in DBT, dialectical behavioral therapy, which is really an offshoot of cognitive behavioral therapy.
Hmm.
And both of those are about reality testing, about looking at what's real and then checking in. And with DBT, it has this whole section which is called interpersonal effectiveness, which is how it sounds. And that's because a lot of people who struggle with regulating their emotions, they tend to either overreact or underreact because they can't gauge what's real, like how to react. And a lot of what DBT does is teaches you, one, how to do the reality testing, and then what is a appropriate way to react given what your goals are in the situation. And I think politically, like this, your truth, my truth, the thing you were just describing, sort of takes that away and
Yeah.
then creates more interpersonal conflicts and then just that inner emptiness, right? Because you're not able to connect with people, you're not able to communicate with people, you're not able to achieve that connection that you're looking for. So, I mean, that's, I think, our goals here
Yeah.
as mental health professionals. We're not here to preach who you should vote for or, what you should think on
Yeah.
this issue or that issue. That's really not the point. It's just about really thinking through what is best for you as a human to
Mhm.
connect with your people in your life, to either connect with your family, create a family, to achieve your goals, all of that. And yeah, so that's why I think this is important. And it
Yeah.
does unfortunately overlap.
Yes, and unfortunately it does. And nowadays it's tough to know what you're going to get when you go to therapy for the first time. And a lot of people are nervous or that they're going to be preached to or they're going to be told that
Hmm.
they're wrong or, scolded and they're paying for this. Like that's what I don't understand
Right.
is that it's like you're coming in and you're asking for help and you're going to be putting down some money and you're hoping that the person in front of you is going to give you good solid support and care. And if they just dismiss you because you have a different opinion or value system off the bat, that doesn't bode well for anybody. It doesn't help
Hmm.
our field, it doesn't help clients. So anyway, I know that we wanted to talk a little bit today about empowerment, and I love that word. I
Yeah.
think it's something that I want to feel empowered as a mom, as a wife, as a therapist, as just a human. I want to feel empowered. So when you think of that word, what comes to mind for you, I guess?
Well, I'm 51, but I've been a late bloomer, and it took me a while to really believe in myself.
Mm,
And I think it really has a lot to do with that, to believe in yourself and to trust your gut, to trust in what you believe. And when we're living in this arbitrary truth world, it makes it even harder.
yeah.
So I think the empowerment is about recognizing when you're being lied to, or even when you have that feeling inside of you where things aren't right, to listen to that and look into it more and to not blindly trust experts, to even when your friends or family are telling you, well, this is what they say,
Mm,
to question things, just to constantly question things and look into it and use your own eyes and ears. And then as parents, I really like to empower parents to remember that you're the parent, that you are in charge. No doctor or therapist or anybody should ever boss you around. Yes, they do have some expertise, they have some training. However, a lot of that training is biased and captured.
mm,
And you're going to have to use a lot of discretion to figure out when is the right time to listen to an expert because they have good advice? And when are the times where you might think to yourself, well, I don't know if this is right, and I want to look into this a little more. And at the very least, I want to be involved. And
mhm.
that is very important.
Yeah. Yeah, no, I agree. I think that's a great way of thinking about it. And I like to say it's like a gut instinct almost when something doesn't feel right and you're being kind of told it has to be this way or this is what we recommend and you're like inside you're like, "Oh, no." Everything is so nuanced." And I think that, you know, we often forget that as well. The information or advice that you're going to get by listening to a podcast or even listening to us today, your situation, the listener, is going to be different than, of course, we're talking about. So you have to use nuance and you have to remember that there's shades of gray within everything. And I feel some people have forgotten that. They want it to be black and white. And if you don't do what they say, then you're in the wrong or you're not you're going to end up who knows where, but feeling empowered and knowing that you have a choice and you have a say and you have a voice is really important. And I think that you and I were talking, prior to hitting record about parenting, about parents out there, wanting to, like you were saying, outsourcing therapy or outsourcing fixing their kid. Kind of
Mm-hmm.
like, you can, like I did it today. I outsourced going to the grocery store. I just don't have time to go to the grocery store. So what did I do? I outsourced it to Walmart. And here I
Well,
am.
that's smart.
Yeah, I mean, it's like I outsourced to Walmart to bring me the groceries. But when it comes to my kids' mental wellness or support,
Right.
for, mental wellness, like I don't want to just send them to somebody. I want to know, first of all, I want to know in, what's really going on. Is it a kid issue or is it a parenting issue? Is it my issue and I'm projecting it onto my kid? Or is there, or am I doing something as the parent or as the adult that is affecting the way my kids are reacting and responding to me? Um, and a little bit of disclosure on my end is I grew up in a household where I felt like I was kind of getting the brunt of things. Like it was put on me. And so of course that I believe affected my personality and how I react and respond to things. And so if I didn't resolve that in my 20s, which I did with the counselor, I'm going to show up into my marriage. I'm going to show up with that as a parent and it's just going to blah. Everybody's going to get my projection of what happened to me when I was a kid instead of working on that like I did in my 20s. So I'm constantly like I probably overthink things to the extent of, okay, Lisa, you just need to chill. Like every little thing I do, I don't have to examine from 15 different angles. I can just do and then see what happens. And, hopefully it's not like an explosion of emotions. But it's tough as parents. And we were talking about how you want to encourage parents to be take a look at their own issues instead of just sending their kid off to a therapist and outsourcing the therapy right away.
Yeah, I mean, my entire career, so I've worked a lot with kids, especially in school settings, and that in of itself sets up this dynamic where me as the counselor doesn't have enough contact with the parents because the kids are at school and the parents are at work.
Mm-hmm.
And then the parents sign the paper and say, "Here you go, fix my kid." And so that's partially not their fault because it's set up that way.
Mm-hmm.
But at the same time, we would try, we meaning myself and the other counselors I was supervising, would try to reach out to the parents to at least have a meeting or have a phone call and have conversation to hear their side of the story or hear about what's happening at home, or at least get to know them so that we can understand what the kid is talking about. There's so many different reasons to talk to a parent, and it was challenging. Sometimes it was challenging just logistically because they were working, of course, but oftentimes it wasn't just that. It was also because the parent just didn't really make the time. They
Mm-hmm.
could have made the time and they didn't because they expected me to just fix it for them. And that just doesn't work.
Yeah.
And this is before things, got more, I'd say, heated when it comes to parental rights and things that are happening nowadays. This was coming from the parents' end, and this was in a more affluent community in California where that I think culturally that was just more common. And it was a struggle because a lot of the times what would have really helped the kid is if the parents were just more present.
Mm-hmm.
I'm not talking about where they should quit their jobs and just completely be full-time at home parents. I mean, maybe sometimes, I don't know, but that's not really what I'm saying. It's more just they just weren't really emotionally and physically present.
Yeah.
And therapy wasn't going to fix that.
Right.
You
Right.
just need to be there.
Right.
You can't like hire the nanny and hire the therapist and hire the cleaning lady and hire all these people to just do your job as a
Right.
parent.
Right.
It just doesn't work. I mean, there's always going to be gaps, and I think that's what we're seeing nowadays. So, no professional, even the most perfect therapist, is going to be able to fix your child if you're not involved in the therapy.
Yeah. Yeah. No, I absolutely agree with you on that. That's you know, just good solid advice right there. I mean, I don't know what else to call that except it makes sense. And I was trained family systems, so a marriage and family therapist.
Same.
I mean that's the reason I got into this work is I wanted to help families. I wanted to help families function at their best, at their peak, and help moms and dads and kids understand how to thrive in their family. And it's tough, like you said. I mean, trying to get as a school counselor, I can only imagine trying to get the parent to come in and half the time maybe they just are like, no, it's the kid's problem and they don't see
Hmm.
their own how what they're doing is affecting the family, the system. I think that's really important. And so when a counselor, when you do, if you are taking your kid to a counselor and the counselor wants you to come in, I mean, I would be, first of all, I would be insisting on family therapy. I wouldn't
That would be
go,
good.
I would not send my kid nowadays to a counselor all on their own. I would insist on family therapy. That's me knowing my kid and knowing that I play a role in this. I have to be a part of the change that's going to happen. Can't I couldn't gosh, I would go like, oh, it drive me nuts if I didn't know what was being said behind closed doors. I mean, kids, I mean,
A
gosh,
lot of parents think like, I don't want to get in the way. I don't want to intrude. I want to give them that space. Um, but no, you should intrude. You're the parent, you're not their friend.
yeah,
And the therapist shouldn't have a closer relationship with your child than
right.
you.
Yeah,
The goal of the therapist should be about connecting you and your child and the family and helping everybody do better together
yeah,
because the therapist is not going to be growing up together and, having a lifelong relationships as family members that
right,
you are with your child.
right.
So if you have a therapist that is insisting on talking to you, that means at the very least that aspect of it. I don't know, I can't say the whole treatment, but that's a good sign. That means you probably have a better therapist because it is actually a lot of extra work and difficult to include the parents. And it's easy to kind of be lazy and be like, well, I'm just going to see the kid and just go to my next appointment because I have a stacked schedule, so I don't have time to call the parents. I'll call them next week, and then it doesn't happen. If they're taking the time to call you, that means they're taking that extra step, and that's a good sign.
Yeah, yeah, so important. I'm so glad. I'm so glad you agree. So glad.
So that's a
So,
lot of what I advise parents.
yeah.
If your therapist isn't involving you, then
Mhm.
butt yourself in, and if they don't let you, then fire them.
Mhm.
And maybe you didn't need them in the first place. That's a whole other, conversation.
Yeah, that's a really good, that's maybe a good episode is coming up would be how do you know if you actually need a therapist versus maybe
Yeah,
you just need some good support. And I mean, I don't ever want to tell anybody not to go to a therapist because I think that, like I
we
said,
can't
it's
know.
nuance and you can't know. And, there's a whole disclaimer that goes along with this podcast about you and I being therapists, but we're not the therapist for the person listening to this episode. So I always want to say, take it as information. And then if you find that your gut's like, yeah, maybe I do need to go and be involved because I am the parent and Lisa and Pam are, they're speaking some truth here. I need to be involved because you are the parent. Yeah, definitely insert yourself. And if that therapist isn't cool with it, then find a new therapist. There's so many good therapists out there. And in fact, I want to give a shout out to the website conservativecounselors.com where you can just I'll put the link in the show note. Just click on it and find a therapist who is going to more than likely align with your traditional or conservative values. So you guys be sure to click on that link if you're looking for somebody, or if you just want to consult with somebody. I know Pam is there. I'm listed there as well. Lots of great therapists are on there. So can you talk a little bit about your book and
Hmm.
why you wrote your book? Because I think it's really cool, really neat.
Thank you. Yeah, so I wrote this book. It's called A Practical Response to Gender Distress: Tips and Tools for Families. Should have named it more simpler, but that's the name.
Well, it probably
And
gets found because those are all like really good searchable keywords, I'm guessing. So
practical. It's
yeah.
practical. And
Hmm.
that's what stands out about it. There are a few other books written by people who, dissidents about the gender don't believe that instant affirmation is the appropriate response, so that hormones and surgeries don't fix all the problems. If you're listening to this, I'm assuming your audience agrees that hormones and surgeries don't fix mental problems. And but even when you know that, it's still you don't know what to do when you have, especially a child who's been really wrapped up, perhaps groomed by people online or even people at school or another therapist or somebody else to believe that they are some other thing that they are, a boy, a girl, or even something else trapped in their own body, or just that hormones and surgeries, even if they don't even believe that, will still fix their inner turmoil, right? Or
Right.
help them feel they belong, help them fix the pain that they have, perhaps cope with trauma, deal with the pain of being autistic and maybe not fitting in, and um,
Yeah.
not knowing how to, be in socially. So there's all these different scenarios. So my book goes into why are kids gravitating towards this? And there's a whole chapter, why are kids doing this? So people can understand what's going on, what are the dynamics here, what are all the influences. And even I've written like I think I listed like 30 things, and I don't think I even hit them all. There's like more things I want to add. I
Yeah.
want to do a second edition
Yeah.
because there's so many things. It's so complex.
Yeah.
Really, this is like a symptom of just so many things, is what
Right.
it is. The way I
Right.
see gender is a manifestation of something else, and that something else could be like infinite, really.
Right.
And so, yeah, I go through that. I go through what are some of the lies that people are being told about gender. The main one is that if you don't affirm someone's gender identity, that they will kill themselves, that they will be suicidal. And I go through why we don't have any proof for that, that the data that they're citing is completely unfounded. Most of the studies that they have been retracted, and they have really small sample sizes. They don't have a control group. We really have no proof of that. What we do know is that this population, the people that gravitate towards being trans, or even the whole general like alphabet population, tend to have more mental health issues. I mean, we could have a whole discussion all day why that is, but that's just a fact that they tend to be more suicidal as a population. So that I think they're weaponizing the fact that this is a group of vulnerable kids, and usually parents of a child who's identifying as trans has a lot of vulnerabilities and maybe even has had a suicide attempt or suicidal ideations already. So everyone is very scared. So I think they're weaponizing that fear and those vulnerabilities. So I go into why and how this is happening. And then what's special about my book, I talk about what you can say to a professional to fight back against these lies so that you are empowered, back to that empowerment. That basically this is malpractice and neglect in the mental health field to be bringing this up, bringing up the suicide topic, especially in front of and with a child who hasn't even mentioned suicide yet. So then you're feeding them that idea, which is very dangerous. So that is on them. That's them practicing poorly, and you as a parent should know that. So instead of being intimidated by these experts, you need to tell them that they are doing wrong by your family. You need to
Yeah.
tell them that it's inappropriate to bring up suicide to a young, vulnerable child who's feeling very unstable and struggling with their identity.
Yeah.
So I go into that. And then there's a whole chapter on how to find an appropriate therapist, questions to ask. Some of them are more general. A lot about the themes we were just talking about earlier in this conversation about involving you, involving the family, making sure they involve your values, that they don't dismiss your values, and they listen to you. And of course, what do they believe about the trans idea? How do they believe the internet influences children? If they think that the internet is, okie dokie, then that's a concern because it's well established now that we know that the internet is influencing children negatively. It's creating a lot of mental health issues. It's feeding them ideas. It's indoctrinating them. And if a counselor doesn't see that, that's a real concern.
Yeah. Absolutely. Those are so important. I stress that all the time. How much internet time are they getting? How much social media time are they getting? What are they doing outside of those things? Like, what are their hobbies? What are their interests?
Getting
Yeah.
them more active. So then,
Yeah.
yeah, then there's a whole chapter on like what to do if your child is trans identified. And a lot of it is just that. It's very simple, honestly.
Hmm.
It is getting them off the internet, a lot of it is addiction. So getting
Yep.
them off this addictive pattern, getting them more in tune with their body. So getting them more physical exercise or just getting outside because that really does make a difference. Because a lot of this is a form of a disassociation and which could come from actual trauma or from, like real struggles within the family, but some of it is just maybe from just being on the internet too much, being inside too much, being isolated too much. A lot of this happened during the lockdowns when people were at home and isolated and continue those patterns. So a lot of it is breaking those patterns and then connecting as a family and taking responsibility as a parent.
Yeah. Yeah. Oh, so much, so much of what you shared. I'm just like nodding my head, and I'm kind of like checking the boxes as a mom. Like, what do we do, or what have we been doing over the past since the lockdown? Still, because I knew. I mean, gosh, I don't want to get off on all that, but we gotta. I feel like we have to bring it back a little bit because so much. I mean, as clinicians, I was just like, no, 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 please do not take these kids out of school
Yeah.
and do this online learning. I mean,
It blew my mind
it,
that this was like okay.
yeah, I mean, like I try really hard not to go there because, it's what's done is done and we have to move forward. But the things
We're
that,
still feeling it
yeah, we
today,
are because
big
the
time.
repercussions of all of that are what, we face
Hmm.
as a society. It's just anyway, oh yeah,
I'm
that's a
meeting a
whole other
lot of
thing.
parents now in my consultations of either young adults or older teens,
Mhm.
that were locked down during that pivotal time, and they're struggling a lot with this trans identity because they were caught on the internet and got indoctrinated and got isolated and had a really nihilistic view of the world because
Mhm.
of all of that happened, and they're still facing those consequences today.
Yeah.
We're really still seeing the ramifications. I didn't realize that gender identity or a bunch of trans kids would be the fallout. I thought we would be seeing. I mean, we are seeing this too, but yeah, I thought it'd be more about like underground child abuse and of course all the cognitive and learning delays that we're seeing. There's all these other things, but I honestly didn't think of the trans thing as what the biggest consequence or the
Yeah.
biggest fallout from all of that.
Yeah, it's pretty wild. I mean, and it's gonna take years to get on the other side of it, I think.
Mhm.
But I'm so grateful for people like you who are bringing light to the topic and helping families overcome this issue and to feel more empowered in how to approach it and how to attack it and how to move through it. Yeah, I feel just so I'm so glad that you're here. And I know that there's a lot of other therapists out there that are doing this work too. So one more time, what's the name of your book?
Okay, it's called A Practical Response to Gender Distress.
Okay.
Tips and tools for families. And
Great. Okay.
it's got a blue cover with pink, so it's got the trans colors on it. It kind of fools the trans activists.
Yeah.
But
And
and it's really just factual. It's not anti-trans or however you want to put that.
yeah.
It just really calls into question about these practices. It talks about how, some of the physical harms. I wasn't aware of. Were you aware of how harmful testosterone was to the body and estrogen and how it causes cancer and blood clots and all kinds of mental health issues and instability and painful periods and
Yeah.
um I mean, I know someone that's struggling with like neurological disorders as a result of it. The amount of physical issues are infinite too. There's so many physical fallouts that have happened from these experimental drugs, the class 2 substances that they're giving out like candy
Yeah.
with only one session. They're giving it out at Planned Parenthood without any kind of regulation.
Oh my
And
gosh.
yeah, it needs to be monitored. It needs to be administered at a very certain time in a very certain way. It's being self-administered by these young kids that don't know what they're doing and they're just following these online influencers. And it's really dangerous. I honestly never thought about all of the consequences before. I honestly was kind of naive to it too. Like, oh, that's just certain people need that to feel better and it's okay. And even the people that really struggle, their health is being compromised. So I care about people who are deeply struggling with gender dysphoria, and even those that aren't trying to do this for attention or any kind of trend. Like there are all kinds of situations, and even those people, everyone is being harmed. This is a medical experiment.
Yes, it is. I mean, it is absolutely a medical experiment. I mean, think about giving these hormones to pre-pubescent, I can never say it right, pre-puberty children. I mean, that blows my mind.
Yeah,
It
the
just,
puberty
I
blockers.
mean,
And
not, I,
did you hear that there was a study that was done by the NIH and the results were never disclosed
mhm,
because it didn't show the appropriate results that the trans activists wanted to see.
yeah.
It was done by a doctor named Dr. Joanna Olson Kennedy. I know her name well because I actually met her because I did a training with her and I had nightmares afterwards. I didn't know who she was at the time, but now I know she's one of the leaders in this, and she has sterilized thousands of kids. She's the head of the gender clinic at the UCLA hospital, and she hid the results of this huge study that was taxpayer funded because it was supposed to show that puberty blockers are helping a children's mental health. But the study did not show that because guess what? We don't have any proof that it does. But what we do know is that it is the same drug that chemically castrates sex offenders,
Yeah.
and it does sterilize them. It causes them all kinds of health issues. It causes cognitive delays, bone development issues, heart issues, lung issues. I mean, they can't develop obviously sexually. They'll never feel sexual pleasure.
Yeah.
Um, there's so much honestly very unknown physically, but it really is barbaric if you think about it more.
Oh my gosh. Truly. Truly. Oh man. Yeah.
And of
Well,
course, children can't consent to their own
yeah.
being sterile or the fact that they'll never be able to experience an orgasm as an
Yeah.
adult. What child can know what an orgasm is like and say whether that's okay or not?
Sure.
And I don't even think a parent can consent that for a child. That's another controversial thing.
Yeah. Yeah, I know. Man. Like my kids get mad at me because, they want their ears double pierced. I'm like, no, no, you have to wait till you're 18. Like,
So
and
funny. I had the opposite argument with my mom. She always
yeah.
wanted me to get my ears pierced. I finally did, and I never wanted it. They got closed up.
Yeah, I know. I mean, so
Do
much. I mean,
parents know what's best? I don't know.
well, yeah. I mean, but I remember being like 16 and thinking that I knew everything and that I should
Right.
have all these freedoms and I should. But I mean, thank God for parental consent because knowing what I know now, I knew my brain wasn't fully
Exactly.
formed for making decisions until what, our early mid 20s. So, I mean, think
So
about
many kids thank their parents later on that they put those limits on. And at the
yeah,
time, they hated their kids.
yeah,
And that's the other struggle, I think, in culture today.
mhm,
And maybe a lot of therapists, I'd say the younger ones, are enabling this where parents want to please their children. They want them to be happy, right?
yeah,
Their goal is to make their child happy. And that sometimes comes at a cost because if they're happy, then they're actually causing long-term damage for them. And then long-term damage for their relationship too, because you, of course, should be the adult. And
yeah.
I think some of that's getting a little muddled nowadays.
Right. Yeah, I think so too. Yeah, I think this whole I just want my kids to be happy. I just want my kids to be happy. And my perspective is sure, I want them to be happy, but I also want them to have to deal with struggle and learn to become resilient and learn to use critical thinking skills and know that life isn't fair. I can't tell you how many times I've heard that. It's not fair. It's not fair. And I find myself, parroting my mom, life isn't fair. And they're just like, what? She got this and she got that. And I want this and I want that. And it's almost like you say these things over and over again until they get it and they have an experience in front of them where you're like, look, life isn't fair. And the reason why, let's talk about this. What happened here that you were expecting to get this, but you didn't get it because why do you think? I mean, it's just like until
They're
you,
gonna say that to their kids, I bet.
oh, yeah.
And they're gonna say,
Oh,
Ma,
yeah.
you were right.
Yeah. I don't know. I tell my mom all the time, though. I'm like, oh, yeah, you're right. You're right. This is, I remember now why you said
Yep.
this or why you did that. I just want parents out there listening to know that if you're going with your gut and you are engaged and you are empowered, then I mean, I can't say that things aren't going to happen and you're not going to mess up, but you are, and you're going to be able to then reflect and hold the mirror up and say, what will I do different next time? And I'm a big believer in that. I'm a big believer in the parents know what it is that we need to do. It's just not always easy because man, we're tired. We're
Yeah.
like, we've got our own stuff going on, but yeah,
And then
so
the world, I think, conflicts
mhm,
what we know is right. And
yeah,
the internet doesn't help. We're constantly Googling or seeing influencers that are giving us all kinds of stuff. And
mhm,
hopefully we're not contributing to that. But I hope for your audience who's listening to
mhm,
this that you think for yourself and you take what works for you and you leave what doesn't.
yeah,
So that's really the goal. So, but there's so many, like you think about all those parenting books and what was his name? Spock, that,
Yeah.
from the 70s, that like taught, it was like, oh, I need a manual on how to do this and how to do that. Well, moms have been mommying for hundreds of years. They didn't have
Mm-hmm.
books for it, right? And
Right.
maybe we would have been better off with less books.
Mm-hmm.
Because I think sometimes it gets us a little confused and we intellectualize things that might come to us instinctively, and we worry about what other people think, and we want to do what they believe is right because we're following a trend. But I really do believe parents should think about what is right for them and their family, and really dig deep and be honest with themselves about what they value and what they think is right for their family.
Yeah, that's beautifully put. So I'm just gonna end the episode on that because I don't think that I could say anything more than what you just said. So Pam, thanks so much for being on the podcast and being my first guest on Just Therapy.
Oh,
I'm
you're
so
welcome.
excited that you're here. Thank you.
I love it. Thank you.
You're welcome. Please note that the content provided in this podcast is for informational and educational purposes only and is not intended to replace professional mental health care, diagnose, or treatment. Always seek the advice of your own licensed mental health provider or medical professional regarding your specific situation. While I am a licensed marriage and family therapist and my guests are also professional counselors, the discussions in this podcast are meant to offer general insights and should not be taken as personalized therapeutic advice. Listening to this podcast does not establish a therapist-client relationship with me or any of my guests. If you are experiencing a mental health crisis or have thoughts of harming yourself or others, please contact a mental health professional, call 911, or go to the nearest emergency room immediately. You can also reach out to a crisis hotline such as the Suicide and Crisis Lifeline at 988 in the United States for immediate support. Every individual's journey is unique, and what works for one person may not be suitable for another, so please use discretion and seek appropriate care as needed.